Below are 28 conditions that can cause urination of blood. 1. Reaction to drugs. Seen in most drugs, for example hypertension drugs, aspirin and penicillin. In most cases it is accompanied with fever, joint pains and liver problems. 2. Bleeding disorder. With this disorder, the normal hemostasis is not achieved. It can be an acquired condition or a hereditary condition. Patients with this condition, most bleed easy even from a small bruising. Nose bleeding, gastrointestinal bleeding and postpartum bleeding is common in these patients. 3. Urinary system obstruction. Most common in patients with tumors. Most common obstruction of bladder in men is prostate cancer and in women cervical cancer. 4. Bladder bleeding. Mostly the mucosal layer. Seen mostly in people undergoing chemotherapy or radiotherapy. 5. Kidney cell cancer. The 9th most common. Higher in men. It is not a common condition for people below 45 years. This condition has been linked to obesity, hypertension and cigarette smoking. People with this cancer mostly have an abdominal mass, flank pain and even urination of blood. 6. Cancer of bladder, urethra and ureter. Tobacco smoking and schistosomiasis are the most contributing factors. Cancer of bladder alone is the 5th most common cancer in United States. Mostly it is a conditions of the old. Females are less affected. Most patients urinate blood but don't experience any pain. 7. Prostate hyperplasia. This is the enlargement of the prostate gland in males. It mostly causes bladder obstruction, mostly a conditions of older men. 8. Sickle cell. Our red blood cells contains hemoglobin. Structural abnormalities of hemoglobin result in sickle cell. It is a hereditary disorder. Most patients with sickle cell suffer from anemia. Boys and adolescents can sometimes urinate blood, although rare. 9. Disorder of blood vessel wall. It can be a hereditary condition, inflammatory process or deficiency of vitamin C. In case of glomerulonephritis urination of blood can occur. 10. Hemophilia. A deficiency of coagulation factor. It is due to mutation in the gene. Common in men. Even with no urinary system disorder, patient can still urinate blood. 11. Anticoagulation drugs. For example warfarin. Like any drug, it has some side effect, nose bleeding, gastrointestinal bleeding, urination of blood to intracranial bleeding. 12. Infective endocarditis. Inflammation of the inner layer of the heart. Mostly affect the valves. During lab investigation, microscopic blood in urine can be found. 13. Urinary tract infection. Commonly bacterial. Common in women but also common in older men. Mostly affect the lower urinary tract. It causes inflammation of urethra, ureter or bladder. 14. Genitourinary TB. TB that is not of the lungs. It can cause increased frequency of urination, pain during urination and even bedwetting at night. 15. Zoonotic disease. Disease transmitted from animals. Mostly seen in tropic and subtropic regions. It is mostly linked with poor hygiene. Mostly affects men. It can result in organ failure, resulting in shock. 16. Ebola virus. Transmitted human to human or in contact with fluid of an infected dead mammal. Outbreaks have been experienced in West Africa. Hemorrhagic signs include nose bleeding, vomiting of blood, urination of blood and even pooping of blood. 17. Bilharzia. Caused by a parasitic infection called schistosoma hematobium. Common in African and can even result to bladder cancer. 18. Infection of human tissue with larvae. Mostly in southern Asia, they are associated with dogs and cats. 19. Aortic dissection. Basically it is a tear in the aortic artery. Mostly in men in their 60s and 70s. Patients experience sudden pain mostly on upper back or chest. 20. Acute kidney injury. Impairment of kidney function, resulting in toxin accumulation. It can be due to decreased fluid volume, heart failure, drugs, bacteria, toxin or malignancy. It can also be chronic kidney INJ. URI. 21. Lupus nephritis. A complications of lupus erythematosus. It is mostly due to deposition of immune complex. 22. Nephrotic syndrome. A conditions characterized by loss of helpful body protein, urination of blood and hypertension. It can result in renal failure. 23. Glomerulonephritis. Due to unknown cause, hepatitis, syphilis, malaria, cancer or even drug. 24. Polycystic kidney. A genetic disorder that leads to development of cysts in kidney. In case of rupture blood is seen in urine. 25. Renal vein thrombosis. Occurs when a thrombus occludes the renal vein. Mostly affects the left renal vein. It is mostly accompanied with flank pain and abdominal tenderness. 26. Kidney stone. A stone develops in the kidney due to crystallization, mostly in the upper urinary tract system. It causes extreme pain. 27. Renal complication due to diabetes. 28. Trauma, for example car accident. Thanks so much for watching this video. Like and subscribe for more videos.